Okay, I'm going to talk about the os coxae, or the coxal bones. These are the bones that make up the pelvic girdle. So again, girdle means support. These bones are going to support the trunk of the body as well as provide the attachment site for the lower limbs and the muscles that move the lower limbs, as well as help support the body weight by transmitting the weight of the body through the lower limbs to the ground. So let's just orient ourselves first with these bones. If you look at from a lateral perspective, okay, so you're looking at the lateral side, and I know that because I see this huge socket. This is called the acetabulum, and the acetabulum is what's going to articulate with the head of the femur. So you can imagine that the spherical head of the femur will be able to fit into this deep socket called the acetabulum. We saw something like this before when we looked at this scapula with the glenoid cavity and the acromion process and the coracoid process, which helps form the glenoid cavity for the spherical head of the humerus can fit into it. But if you look at this acetabulum, it's much deeper. This allows for the head of the femur to really fit in and be really supported. Unlike the shoulder, this os coxae, along with the femur, really has to support a lot of weight due to the trunk of the body. So it's a much deeper socket. It allows the head of the femur to really fit in there and be well supported. I point out the acetabulum because here in the acetabulum is where 3 bones fuse to form one coxal bone. And those 3 bones are going to be, which are now regions because they fuse into one bone, is this upper flared out region called the ilium. When you think ilium, think the hip part of the bone, okay? What you would feel and be able to palpate as your hip, okay? This anterior region right here, this would be the pubis. And then this posterior region that forms this somewhat L-shaped part, this is the ischium. When you think pubis, it's on the anterior side. Directly behind this part of the bone would be the internal genitalia, the urinary bladder, all of that, all of the organs of the pelvic cavity. And then when you think ischium, think butt bone, okay? And then again, all 3 of these regions fuse in this structure right here called the acetabulum. All right, so let me go ahead and go through each region of the coxal bone and talk about some structures you need to know. Again, this is the lateral perspective, and I know that because I see the acetabulum. If I look into the medial perspective of this bone, this concave surface, this smooth kind of surface right here, this is called the iliac fossa. This is where a large, broad fan-shaped muscle called the iliacus lies. This up here, this big fanned out region, this is the iliac crest. So this is the iliac fossa, this depression, and this is the iliac crest. Okay. I'll go ahead and point out this area right here. It's very rough, somewhat square-shaped rough region. This is going to be where the sacrum articulates. So this is how I know this is the medial perspective of the bone, because this is where the sacrum would articulate. Okay, let's see. If you look, so here's our big iliac ilium, these big notches right here. This is the greater sciatic notch. This is the lesser sciatic notch. The greater sciatic notch and the lesser sciatic notch, greater because it's larger and also above or superior to the lesser sciatic notch, which is smaller and inferior. These allow for blood vessels and nerves to pass through. Let's talk about here on the ischium, this rough region on the very posterior side of the ischium. This is the ischial tuberosity, which is going to serve as attachment sites for muscles and tendons. The ischium is important in supporting the weight of the body when you're in a sitting position. So butt bone, ischium, okay, supports the weight of the body while sitting. This huge hole, anytime when we're talking about the skeletal system, we use the term foramen. Foramen means a hole. This is the largest of all of the foramina in the body. This is the obturator foramen. This allows for blood vessels and nerves to pass through. So the obturator foramen. When you're looking at the pubis, this region that kind of juts out right here, this is the pubic tubercle. Okay, the pubic tubercle and certain ligaments. It serves as an attachment site for ligaments. And then we have the pubic crest. The pubic crest. Okay. And I think that is it. Oh, let me talk about how right or left. I apologize. You have to be able to tell me which bone is right or left. Easy way to do that. Again, if you see this big socket, this deep socket, this is going to be lateral. And if you see this rough, somewhat cuboidal-ish region, this is where the sacrum is going to be, and that has to be medial. And the pubis has to be towards the anterior. So if you fit these together, it would be somewhat like this. Okay, all right, so this would be the right, this would be the left. Okay, so you want to put the pubis towards the anterior, you want to put this rough region where the sacrum would be medial, okay, and the acetabulum is always lateral. Okay. So this would be the right, this would be the left. Okay, and that's it for the os coxae.